Hi, my name is Hunter Bailey, and today I'm going to be performing the Soap Suds Enema checkoff. And here is my College of Nursing ID badge, and you can go ahead and scan the room for me. Okay, so the very first step that I'm going to do is verify the physician's orders and verify hospital policy. So there is an order for Soap Suds Enema on arrival to 4, and I would verify hospital policy. I'm going to go ahead and identify my patient using 2 patient identifiers. Jaguar Jones, medical record number 4176352, medical record number 4176352. I would assess for any allergies. So there's an allergy to penicillin, and he has an armband to penicillin. So now what I would do is explain the procedure to my patient. Mr. Jones, today I'm going to be giving you a Soap Suds Enema, okay? Do you have any questions? No? Okay, good. So now I would provide privacy. So now I'm going to gather my equipment. So I have my cast-oil soap, I have my waterproof linen, and I have my enema with my enema bag. I have my clean gloves, I have my goggles and my wash rags, and I have my bedpan. So now what I'm going to do is perform hand hygiene and don my goggles. I'm gonna move to the sink. So I'm gonna move my cast-oil soap with me to the sink, and I'm going to move my enema in my enema bag and dispose of the wrapper. I'm going to go ahead and turn the sink on warm water, but not too hot. Okay. And I'm going to fill the enema bag up to between 750 and 1,000 milliliters of water without letting the tubing touch the inside of the sink. Okay, and it's an appropriate temperature, so it's not touching the sink, and fill up between 750 and 1,000 milliliters. Okay, and it's between 750 and 1,000 milliliters of water. So I'm going to turn the water off. I'm going to move away from the sink just because I don't want the tubing to touch the inside. And I'm going to open the hole to the enema. And I'm going to add my cast-oil soap, my pure cast-oil soap, and dispose. And I'm going to gently agitate the solution. I'm gonna move back to the sink and set my enema bag down. And I'm going to prime my tubing. So I'm going to take the cap off, and I'm going to prime the tubing, and it works. So I'm going to set my bag back down. I'm going to cap or reclamp and put the tube back in. So now I'm going to move over to my ID pole. I'm going to place it and just curl up the tubing and sit it right here because I'm about to use it. So now what I'm going to do is I am going to move the bed up to a comfortable working height and lower the side rail, and I'm going to go ahead and position my patient in left lateral sins so they'd be laying on their left side. And I'm going to get my waterproof linen and place it under my patient. And I have my bedpan near. And now what I'm going to do is I'm going to don my clean gloves. So now that I have my clean gloves on, I'm going to go ahead and pull the sheets off my patient and expose the buttocks. And so I am going to take my tubing and I'm going to remove the cap and dispose. And I'm going to verbalize this, but I would lubricate the tubing 3 to 4 inches. But this is already a pre-lubricated enema, so I'm not going to do that today, but I would lubricate it. So now I'm going to place my hand gently but firmly on the patient's hip and spread the buttocks. And if they have hemorrhoids, I can tell them to bear down and take deep breaths. And I'm going to insert the tubing 3 to 4 inches into the rectum. Okay. Now that it is in, I'm going to hold it because I'm not going to let go. And I'm going to remove my enema bag off of the IV and sit it down, or the IV pole and sit it down. I'm just going to verbalize this, but what I would do is I would unclamp the tubing so the water can flow in, and I'm going to hold this 12 to 18 inches in height and let the fluid go in. If the patient is cramping or they're really uncomfortable during the procedure, I can lower the bag back down and clamp the tubing and tell them to take deep breaths. So I have my bedpan right here. So now that all the fluid is in, I'm going to remove and tell them to hold it for 10 to 15 minutes, and I'm going to discard of the enema. So Mr. Jones, can you hold the enema for 10 to 15 minutes, okay? I'm going to go ahead and place the bedpan under you and provide comfort. So for the bedpan, this end would go under the buttocks, this end would go towards the thighs. So I would place them back in a normal position and place the bedpan under. And I would put the covers back on. So now what I'm going to do is I would remove my gloves, my clean gloves, and dispose and perform hand hygiene. I want to verbalize that I would come back in 10 to 15 minutes after the patient has voided. I'm going to wash my hands. I'm going to put on some new clean gloves, and then I have my washcloth, and I would have a towel, and I would remove the bedpan, and I would place the towel over it and place it to the side, get my washcloths or my wipes, and I would perform perineal care. And then I would maintain the patient for comfort again, remove my gloves and wash my hands. Now for documentation. So for documenting, I would document the type and amount of enema, how the patient tolerated the procedure. I would document the time that I gave the enema. I would document the color and amount of return and how the patient was left. And this concludes my soap suds enema checkoff. Thank you.